Thank you very much. Good morning, good afternoon, and good evening. Distinguished guests, ladies and gentlemen, I would like to share with you our experiences as Zimbabwe in terms of the progress in implementing the ICPD commitments that we made in Nairobi in 2019. Zimbabwe has been implementing the ICPD plan of action since 1994, with regular reviews being conducted with full participation of key stakeholders. Post-Nairobi Summit, the country developed the National Development Strategy and constituted a multi-sectoral National Task Force on Population and Development, the NTF. The National Task Force subsequently set up a monitoring and evaluation technical working group that developed an indicator framework for the objective monitoring and implementation of the ICPD plan of action. In terms of the implementation framework within the country, we intend to intensify our efforts for the full and effective accelerated implementation and funding of the ICPD plan of action. Zimbabwe launched the National Development Strategy, the NDS, in 2020. This provides a policy framework for population and development issues and the Sustainable Development Goals. The National Health Strategy 2021 to 2025, the Community Health Strategy, and the finalization of the SRH implementation plan and the Family Planning Strategy will further strengthen sexual reproductive health programming in Zimbabwe. Capacity building in population and development is an ongoing process through scholarships that we get from India, Egypt, and South Africa in training in population and development issues. We have also initiated best practice sharing with Ghana and Uganda in the area of sexual reproductive health in population and development. We are also preparing to conduct our population census in the year 2022, and preparations are at an advanced stage. On maternal health and sexual reproductive health, I think maternal mortality remains a major public health problem in Zimbabwe, even though progress has been made with the reduction of maternal mortality from 651 per 100,000 live births in 2015 to 462 currently. More effort is still required. Although we have achieved our FP 2020 targets of a CPR of 68%, we still have an unmet need for family planning of about 10%. The government is committed to ensure access for adolescents and youth to comprehensive and age-appropriate information, education, and youth-friendly sexual reproductive health services. However, teenage pregnancy remains very high at about 24%, and the efforts to address this challenge will be strengthened through the various policy frameworks and also scaling up comprehensive sexuality education. In our efforts to ensure universal access to sexual reproductive health, we have developed an integration framework for sexual reproductive health, family planning, HIV and AIDS, and maternal and child health. And we've intensified mobile outreach services to reach underserved areas, especially during COVID-19 lockdown. Gender equality and vulnerable remain issues of concern in our country, and these have been COVID-19 pandemic. This framework to ensure that 18 years. Government established 7 one-stop centers for survivors of gender-based violence, with all key services being provided under one roof. Women empowerment framework is in place to provide financial support to women and girls. The Disability Act is being finalized to implement for implementation so that we leave no one behind. The government continues to promote human rights for the vulnerable and marginalized population to ensure peaceful, just, and inclusive societies through policies that protect the vulnerable. In terms of financing options, financing of the ICPD plan of action is through the national budget process and exploring new and innovative financing instruments to ensure full and effective implementation of the ICPD plan of action. 13% of the current national budget has been allocated to the health sector in 2021. Discussions are in progress to identify innovative ways to improve domestic funding. This includes levies for airtime, beer, and cigarettes, which will be channeled towards health systems strengthening. We continue to engage development partners in the effort to maintain official domestic assistance to support population and development agenda. In terms of harnessing demographic dividend, young people constitute a big part of the population. Therefore, harnessing the demographic dividend by investing in adolescents and youth is a key priority for Zimbabwe. The country commissioned the demographic dividend report in 2018. Meaningful youth involvement across sectors has been strengthened through enactment of the National Youth Act and mainstreaming youth policy across all sectors of the economy. The government has resuscitated and recapitalized vocational training colleges in all provinces to improve skills based amongst young people. Youth participation in legislative and policy processes is happening through the Child Parliament and the Youth Council. Emergency preparedness, basic humanitarian needs of affected populations, including sexual reproductive health, are addressed as critical components of responses to humanitarian and environmental crises. The recent devastating effects of Cyclone Idai and current COVID-19 pandemic has made it urgent to have a robust humanitarian response framework. A national emergency preparedness framework coordinated by the civil protection unit of government, is in place at national and local level. Mobile and outreach services for sexual reproductive health and sexual gender-based violence have been put in place, and the various structures have been capacitated to handle similar crises in future. Better coordination of development partners, private sector, for society organization is required for an effective and comprehensive response mechanism. In terms of availability of quality, timely, disaggregated data, and investing in digital health innovations and improvement of data systems are essential to achieve sustainable development. The government continues to invest in the statistics lead agency, ZimStat. This will ensure sustainable development indicators are measured with full disaggregation in accordance with the fundamental principles of official statistics. A monitoring and evaluation framework for the ICPD plan of action has been developed with indicators covering all the critical sectors necessary to monitor implementation of our commitments. In conclusion, the government of Zimbabwe is committed to fulfill the promises made at the Nairobi summit. However, progress in some areas has been limited due to various factors, including sanctions and the current COVID-19 pandemic. The National Development Strategy, National Health Strategy, and other policy documents that are in place will further strengthen government commitment to achieve the ICPD 25 goals. I thank you.